Hi, Dr. Baumholtz, and today we're going to talk about liposuction. So, what is liposuction? Well, lipo, fat, and suction. So, historically speaking, liposuction can address areas of fatty deposits and even large areas of fatty deposit by using a wetting solution, which is a solution that we put in under the tissue to help decrease bleeding and to decrease discomfort following liposuction. That fluid will sit, that medicine will sit for a period of time, usually 15, 20 minutes, sometimes more, sometimes less. And then the liposuction is performed removing a certain amount of fat. If we're going to remove more than 5 liters or 5,000 cc's of fat, generally speaking, the major plastic surgery societies recommend that that person be admitted overnight to watch how they do. This is a safety concern. Can you take more than 5 liters? Yes. Can it be done safely? Yes. But the caveat is, the recommendation is that person would be admitted overnight. It's what we do in our practice. Next, what are the risks of liposuction? Assuming we're going to someone that is board certified and appropriately trained in the use of liposuction, the risks are relatively small, but there are real risks. Bruising, swelling, I wouldn't even say that's a risk. You can expect that's going to happen. You can actually lose skin if the liposuction is too aggressive. The skin can get too damaged, believe it or not. The risks of combining liposuction with other operations increase the overall risk of that surgical maneuver, whatever it might be. Contour irregularities, either small ones, little rippling or dimples of the skin, or bigger ones where one side doesn't look like the other side. You can then have more rare but more serious risks where something in the area is damaged unintentionally. So again, I mentioned we're taking a big metal stick, we're jamming it under the skin. I'm going to use those kinds of words. We're going to put it under the skin. Let's not use euphemisms. And then under suction, we're going to suction out the fat. Well, it's possible to injure the surrounding organs and tissues if the cannula were to go through the body wall or into the tissues. Does it happen? It does. Is it very rare? Fortunately, it is very rare, but you can read descriptions online of this happening, and hopefully your surgeon will explain those risks to you. Nevertheless, we think it's important to have your liposuction done in a center that is geared for patient safety and by someone that's trained to do it. Well, that's a short introduction to liposuction. I hope it was helpful. This is Dr. Baumholtz. Thank you for listening.